my bill in there. I'm not moving. So it's going to be pretty entertaining to see how that works out. He's back on the line with us. Let's get Dr. Akimoto on the show. Dr. Vince, good morning.
Good morning, Chris. Good morning. How are you?
We're doing okay. We were just trying to get a hold of you, first of all, to kind of discuss as we're ramping up on the COVID-19 response and the extension of May 5th and, 17 positive cases last night. Where are we in moving out these patients from the Guam Memorial Hospital? Because we can't seem to, it's like you hear the doctors are saying it's urgent, but then Lillian Posada says it's still something that they're talking about. So what are your thoughts on that, Doc?
I think they should have done it last week. So hopefully it'll be done today. There is really no excuse for it not to be done already. We hope they're not waiting for somebody to get hurt. It's ridiculous that it hasn't get done. I just been speaking to all my colleagues at the Guam Regional Medical Center. They're frustrated too because they've been ready to receive for many days. They've worked very hard to ensure that their facility is ready to receive. So this is all on the back of the Guam Memorial Hospital leadership. They need to wake up this morning with the resolve to do the right thing. And hopefully all of you who are listening will call them and let them know your feelings. Call your governor. It is ridiculous that during this time when the governor has already stated that we are in a very dangerous time out in the community, you can't even go visit, apparently your grandmother or your auntie. They're sending pregnant women to give birth in the Guam Memorial Hospital.
The COVID hospital. Let's call it what it is.
Have
That's
you
the
heard
hospital.
what exactly is the holdup? Because it was a week and 2 weeks, I'm not even sure, when the governor announced this new cure team, the COVID Unified
Response.
And she was asked if she thought that it was necessary to move, and she agreed that it would be, and it would be done when the time was right. Dr. Mike Cruz has confirmed that the move should happen, will happen, can happen. So this does fall onto the Guam Memorial Hospital leadership. I do not know why they're stalling.
Yeah, and then every time we ask about it, it's like they get mad. So I don't know.
Well, then you should get mad because these are your moms, these are your daughters, these are your nieces, nephews, friends. They're scared. I mean, I would imagine that these pregnant ladies want to argue, but how do you argue, right? I mean, again, this is not a good thing. I don't know why it's going on. It's unnecessary. We have other things to be.
There's just no place to put them? I mean, I just don't understand.
No. Is it the nurses, Doc? Is it something to do with the nurses and GMH?
I'm sure it does. So if you want my opinion, the reason why this is happening is GMH doesn't want to lose its nurses. A lot of their nurses that work on OB and pediatrics are cross-trained to work in the emergency room and they're trying to get them into the ICU. So basically, this is an even worse reason is they want to use the same nurses who deliver babies, help do C-sections, to go down and get their hands dirty doing coronavirus patient care. It's ridiculous. It's a stupid idea. The housekeepers are also vectors for disease. The food handlers, there's just the doctors are the worst.
The dietitians, we saw a dietitian that had tested positive, right?
Yeah.
Right, so this whole thing is just a bad idea. I don't know. So get Dr. Annie Berdalio on the air. She should face the people of Guam and explain her logic. There is no logic as far as I'm concerned, and I'll debate her about it if she wants publicly. But this is ridiculous. It doesn't do anybody any good. It's causing a lot of grief. We wouldn't be bringing this in if it wasn't for the fact all the families are screaming at us to do something about it. So here I am. I'm going to take the hit. And Dr. Berdalio delivered my baby, so I'm very confident in her judgment. I believe she's a great doctor and a good woman. However, in this case, she's making the wrong decision. She needs to move the women and children out of GMH now, right now.
I think it was said, though, maybe it was Lillian, that the priority first is the adult patients, non-COVID patients. Move them out first.
I'm pretty sure, Sabrina, those patients would say save the women and children first.
Right.
So the priority is upside down. You always take care of the women and children first. So at any rate, can I give you a...
Right, Doc, we want to ask you about, because I talked to you over the weekend, commercial testing. Now, there was a problem with public health put out a memo on Monday saying, hey, anybody who wants to get commercially tested, go to the clinics that we heard from one of your partners, Dr. Hoed, that all the legwork was, nowhere to be seen, that you guys weren't folded into this decision. But apparently it's been a good week for the effort to get commercial testing done on Guam. So what can you tell us about that?
Again, the answer is yes. Over the weekend, it looks like the decision now is to open up commercial testing through DLS to anybody who wants to come and get the test. But it needs to be done in a way where basically you go to the tier 2 clinics, the basically extensions of the Guam Memorial Hospital, which would be FHP clinic, SDA clinic, and the American Medical Center clinic. You need to know, everyone needs to know that we do still see, in fact, we expect to see a lot of very sick people in our clinics, and so American Medical Center has divided itself up into the McGill Clinic, which will take anybody with a fever and a cough and who might have COVID-19 or any other sickness where they have a fever, and so that clinic is going to receive patients from 8 until 6, and you can go there. And then in the evening, if you have to come in, it's from 6 to 9 at the Tumon Clinic at AMC, where we can do testing as well. So I man the day clinic at Tumon, which we call our clean clinic. We don't accept people with fevers. We want you to come in if you need to get your medicines refilled, if you have an injury, a laceration, something that doesn't involve a fever or cough. You would come to the Tumon Clinic, where we would take care of you in a clean setting where COVID-19 should not be. But then after 6, we open up that clinic until 9 to do COVID-19 testing. But right now, our strategy is to do everything outside. So when you come in, your car would be parked with other cars. We do all our necessary medical check. And the longest part is the questionnaire that the public health requires us to fill out. Then we do your swab and you're out the door. So if you're just coming in for testing, there is a process. Go ahead and call the American Medical Center for it, and we'd be happy to describe it. But it's as close as we have to a drive-through at the American Medical Center in Tumon at night. Mm-hmm. We can only handle probably about 20 people a night right now. We're trying to figure out how to make it work even more efficiently, but it's better than last week. So if you want to get tested, if you've been refused testing in the past, if you're a labor and delivery nurse, if you're an emergency room nurse, if you're anybody that needs to get tested, call the American Medical Center, call SDA, call FHP. Try to make it so that it's done in a way where you're just in and out, and right. That's our goal.
Yeah. So, Doc, you get the swabs, you send it over to DLS, and then it takes 5 to 7 days, correct?
That's what we're hearing. Yeah, and so it's actually not going to Hawaii; it's actually going to the States, and so they're trying to fix it so it stays in Hawaii, or better yet, DLS brings the machine to Guam, because we have a lot of cases to run. So everybody wants to run tests. But I'm so proud of my brothers and sisters in the Navy. They've been doing 500 a day. So mm-hmm. I go figure. Guam is good.
Maybe Doc,
we're struggling. Yeah.
Do those results have to be reported to public health?
The 500 a day that the Navy is.
Oh no! I'm talking about the ones that go through DLS.
Yeah. All of them. Yes.
Everything goes through. Okay.
So Doc, there's no sense of doing testing.
Right. I just want to make sure.
It's free. It's free. So you cannot be charged for doing tests. Now we can charge you if we're going to take care of your rash or fill your diabetes medicines, but we can't charge you. The only reason you came is to get COVID-19 testing.
Right. Doc, so I got to ask you, when these people come and they get tested, what advice do you give them? Because, they're getting tested, they're getting swabbed, and they're going and doing, well, hopefully they're doing what they're supposed to be doing, which is staying home.
Yeah, and most of the people that we've been testing up to now are very concerned, so they put themselves into isolation, and even more so now, because you shouldn't be. The only reason why you came out was to come and get tested. You can't go to the mall, you can't go anywhere. So yeah, the rule still holds. You get tested, that means you thought you were sick, you thought you might be infected. All the more so, you should limit your exposures to other people, and just watch out that the people around you aren't sick, so that they can too get tested and treated. We're more worried right now about heart attacks. We're more worried about people that diabetes is out of control, that might be having a stroke because they're so anxious. Right now, it's been 3, almost 4 weeks that we've been in this. A lot of people with chronic diseases, if that's your brother or your friend, tell them to get checked by their regular doctor, because we're really, really worried this week about a tidal wave of preventable, non-communicable diseases like heart attacks and strokes. It's a dangerous time, and so people need to be proactive with their care. If you're the friend of somebody that is sick, get them in. And if you're smoking, quit. Quit. Bury that thing 6 feet deep before you're buried along with it.
Hey Doc, so let me ask you this. So we're going to test. You're saying you want to test 20 people a day. I'm assuming the other clinics
from 6 to 9.
From 6 to 9, right?
Yeah.
So in 5 to 7 days, when we get these results back, and we end up with 50, 60, theoretically 70, whatever the number is going to be, positive COVID-19 patients.
Yep.
In your opinion, are we ready to deal with that?
Yeah, I think those people that are going to come in and get tested this week with the commercial testing are most likely the ones that, they didn't even know they were sick. They weren't sure. So these are folks who are basically asymptomatic or minimally symptomatic. So you're going to do just fine. Like we've been talking about before, 80% of people that get this won't even notice it because they probably have had worse coughs and colds in their life. Your immune system is strong. Your immune system is champion. So you're going to do fine. It's the 15% or 20% of people that are going to suffer. And those folks are the ones, some of whom, maybe about 10%, wind up in the hospital. And on Guam, maybe about 4 or 5% of them are going to die. So typically, those are the people that we're trying to reach out to right now. And I think Guam is doing a good job about it because according to the folks at GMH, they're able to handle what's happening now. It's the ICU beds that we're really worried about because although we're going to get more machines, you heard the good news that there might be ventilators coming.
30 ventilators.
We don't have enough nurses. And our nurses are starting to get sick. They're trying to prepare the doctors to do it. But, again, this is that deep water that we wanted to avoid by, keeping everybody at home. The whole reason we've stayed home for the last 3 weeks was to try to stem this tide. Well, we failed.
Yeah.
The reason why the governor extended it is because a bunch of you bozos got other people sick. So could you quit fooling around? I mean, hopefully this wasn't because people decided to go to church, in the middle of the night thinking that they were somehow blessed and they weren't going to make each other sick. It seems like it's all the churches that are causing this problem, and it's not because their God is not good. It's probably because this is the same infection that God sent down on the Israelites, and it's part of those 10 plagues. And maybe so people need to start paying attention. In fact, if I could go dark just for five minutes, people need to start talking to each other, turning to each other, and tell your loved one, the one that's going to help make decisions for you, what you want done if you stop being able to breathe, if you're starting to have COVID-19 symptoms that are going to wind you up perhaps on a ventilator. This is serious time, and the young people are getting affected. Tell your loved one, do you want to be resuscitated? Do you want to be in the ICU? Because you need to know this right now, is that you will die alone. You will die, with maybe somebody that you don't know, who looks like a space person, fully gowned, plastic glove, and they'll be holding your hand trying to whisper, whatever, a prayer. But you will die without your family. You will die alone. If you don't believe me, talk to the doctors in Italy and New York who are turning off ventilators on people and crying because their families are not there and having to make phone calls to people and say,
Doc, I mean, we talked to family members of people who've passed from COVID, and they've told us themselves that they didn't get to say goodbye.
So this is happening now, and let me just be absolutely clear. It's not a good thing that so many people have already died here on Guam, but at least right now it looks like these are people that had diseases that predicted that they would die, and as far as I've heard, some of them had already decided that they didn't want to be resuscitated, but for some reason they were brought to the hospital, and so the doctors there had to do what they had to do. Look, if you don't want resuscitation, if you don't want life support, and if you don't want to be in the hospital to die, write that down. Talk to your friends and family, but write that down. It's called a DNR, a Do Not Resuscitate list. Many of you probably already had it and you threw it away. So get a piece of paper. The main thing is that you tell people this is your wish, so that you don't call the medics. Why would you call the medics if you're not going to go to the hospital? Now, if you're scared, if you're afraid, if you need oxygen, we need to have a system in place where we can come to you and help you do that. And if your situation at home is not safe, we need to bring you to a safe place. Those things are in progress. But what I would suggest is you go ahead and call the medics, but then you give them the sheet that says do not resuscitate, and then the medics should have that solution by the time this phone call is over. I mean, this is how we're going to spare people unnecessary pain and suffering. This is how we're going to keep families together. But this is also how we prevent GMH, Guam Memorial Hospital, from being overwhelmed with patients who don't want to be there. What we're finding is that when the patients go there and they're told they have to be admitted, they want to leave. And so they probably shouldn't have been brought to the hospital in the first place. But what happened last week is going to be improved upon this moment, today. What you need to do as you're eating your breakfast, tell your loved one, if I go down, if my breathing goes down, this is what I want to have happen. I want everything done, take me to the hospital, put me on life support. I want to live. And most of you should want to live, because it's only about, right now in Guam, about 4 to 5% people that are dying if they wind up getting infected with COVID-19. And that's terrible. We have one of the worst rates in the nation, right? It's terrible. But, again, we'll improve upon that. It's supposed to be around 1%, 1.5% of people who get infected, and especially if they get that sick, should die. But you need to let people know what's going to happen with your body, with your, end of days. and I'm very, very, very serious. I'm not fooling around. Write it down, put it on your refrigerator so when the medics come, they can grab that paper and show it to the emergency room doctor, or call what's called a hospice advisor, for lack of a better word. Is that instead of going to the hospital, you may go to something called a hospice or a triage center, where you'll get oxygen, you'll get morphine, you'll get treated, you won't suffer, and your family will hopefully be able to be more close to you. Again, I can't promise anything because this is stuff that we've been working on through the weekend.
Right.
But the gist of it is, tell people that you love what you want done when you can't breathe, when the COVID-19 thing starts to take your breath away. Because we need to move quickly. You're going to call 911, and 911 right now will take you to GMH. And if you didn't want that to happen, then you should have told somebody about it.
Take me to Naval Hospital.
They don't want.
They only have 42 beds at Naval Hospital, and
yeah.
they have over 155 sailors that have tested positive.
Doc, this is.
In fact, here's a question to the Admiral: if they start having people that need to be on ventilators, are they going to put them in their fancy smancy new hospital, which has to take care of active duty personnel who don't have COVID-19 and potentially contaminate that facility, or are they going to admit them to GMH because GMH has already been identified as our coronavirus hospital? And so they can probably perhaps put those military guys who are sitting in the hotels, bring them over to the hospital if they can't breathe anymore, right next to our pregnant ladies who are giving birth and our cute little babies in the newborn nursery. So if the military plans to use GMH as its coronavirus hospital, it'd be nice to know. So maybe the next press conference, some intrepid reporter will ask the question.
With one of his 2 questions.
Okay, write it down.
Yeah.
Email it.
Doc, thank you so much. I mean, you're always sobering to talk to you. I just wanted to
Real
share
talk.
a comment with you from Angelica. Writes here, we should hold a rally outside Guam Memorial Hospital to move all the non-COVID-19 patients to GRMC now.
Yeah, go do it. Just stay 6 feet apart.
And it's not a social gathering; it's a protest.
Why don't we do a Zoom one first?
Yeah, okay, a Zoom rally.
I don't cause any trouble, but
baby
Zoom
steps.
Rally, and that don't work by 9:15 this morning. Then go down to GMH and rally 6 feet apart.
Doc, again on the commercial testing, I just want to close with this. We had a comment here. What is the criteria to test? I know someone who was denied testing even with several symptoms. Is there a cost? Person doesn't have insurance.
I just answered that question.
I know.
You're not paying attention.
No, I am paying attention.
No, not you. They are.
Yeah.
And that's the thing. A bunch of you bozos out there. Quit chewing your gum. Pay attention. It's free. If you get refused last week, you can come now to a tier 2 clinic and get tested. Pay attention. You guys are on playing with your memes.
Right.
Pay attention.
There you go.
Okay. Thanks, Doc.
Straight up. Thank you, Doc. That's what people need to hear. People being straight up.
Yeah. And definitely, I think that the people of Guam, we are ready for the stern news, for the going dark.
Yeah.
I think, reassuring us.
That got me.
Yeah.
That got me.
So, yeah, this is something that, wow, I haven't even thought that far ahead.
Mm-hmm.
But, I mean, you need to, because this thing, it works fast, and if it catches you, I mean, you don't want to leave your family in the lurch, not knowing what you want. That's something you need to do, because like Dr. Akimoto said, these people are dying alone.
Mm-hmm.
Okay, and by then it's too late to tell them,
Mm-hmm. And you know what? Saturday we recorded the 4th death related to COVID-19, and we're at 112 confirmed cases. People, please.
We have the power. We said it earlier. The governor does not have the authority to lock us down, but you know what? We don't need her to have the authority. We have that power. It's power of the people. It's the one thing that we can deliver on this morning.
We are on the front lines.
Yeah, so stay your ass home. You know what I mean?
Stay your ass home.
I mean, it's just
mask up.
Mask up, everybody.
Wash your hands. I mean, look at us. We're wearing a mask, and
Yeah.
But we're required to.
I'm getting gloves tomorrow.
I gotta show everybody my first aid kit.
Yeah, Bria's ready to go. I mean, she's been like zombie apocalypse ready since before all of this. I called her last night. I said, "Girl, you got gloves?" She was like, "Chris, who are you talking to?" She has enough gloves to run a small field hospital.
No, don't even go there. Okay. But yeah, I got some gloves.
Hey, so can we just talk real quick about